Picture this. A radiology director walks into her department on a Monday morning. The scanner is fine, the images are fine. What's not fine is the tech who threw out his back lifting a patient, the probe that just failed a disinfection audit, and the MRI slot that's been empty for 3 weeks because a rural clinic 2 hours away doesn't have one at all.
Yeah, that's the side of imaging nobody puts on a conference brochure. And it's exactly what we spent the week talking about in Orlando.
This year's AHRA theme was Where Imaging Meets Imagination. And honestly, it fit, because the imagination on display wasn't in the scanner bore. It was in everything built around it. Positioning, safety, patient experience, access, infection control, the unglamorous stuff that actually determines whether a department runs well or runs on fumes.
Yeah. AHRA also partnered with ARIN this year, which brought imaging nurses into the same room as imaging leaders. Two groups solving overlapping problems from different angles, finally comparing notes. That collaboration theme showed up everywhere on the floor, including the companies we want to spotlight.
Let's start with a problem every tech has lived through: positioning a patient with kyphosis or limited mobility for an MRI. It usually means multiple staff members manually lifting a pile of pillows that shifts halfway through the scan, and a result that's inconsistent at best.
KyphoLift solves that with a single, stable platform one technologist can operate alone. No manual lifting, no improvised padding, no repeat scans from motion artifact. It retrofits into the existing MRI suite too, so there's no capital overhaul required.
What stood out was the math behind it. Manual lifts routinely exceed OSHA's 35-pound safe handling threshold. That's a workers' comp claim waiting to happen. KyphoLift turns a 2 or 3 person safety risk into a 1-person repeatable process.
Yeah, it's a small device solving a big problem that administrators feel in their staffing budget and their injury reports every single quarter.
Speaking of things no one thinks about until they go wrong, let's talk about lead aprons.
Right, now this one surprised me. A Wayne State study found that the majority of lead aprons tested in hospitals carried bacteria like staph, some even MRSA. These garments touch every patient and every tech in the department, and most facilities are still just wiping them down.
Yeah, RadCare Services built a full service model around this. Deep cleaning, disinfection, repair, x-ray inspection for cracks, and inventory tracking, all documented for Joint Commission and CDC compliance in one platform.
Yeah, it's not a flashy piece of hardware, it's infrastructure. But when a surveyor asks for garment compliance records, this is the difference between a 5-minute answer and a scramble through spreadsheets.
Now let's go inside the bore itself, because patient experience is still one of the biggest hidden costs in imaging.
Yeah, claustrophobia and anxiety don't just make patients uncomfortable, they cause motion. And motion causes rescans, and behind every rescan is lost table time and a frustrated tech.
UX Platforms addresses that directly with an in-bore video and audio system that gives patients a calming visual environment during a scan instead of a few inches of white plastic. One outpatient center reported an 87% drop in the need for rescans after installing it.
Yeah, that's not a soft, feel-good number. That is throughput. That's revenue. That's a scanner running the schedule it was built to run.
Access is the next piece of this puzzle, and that's where United Imaging did something different this year.
Yeah, their MRI Experience Tour is a mobile roadshow in partnership with Shared Medical Services, bringing the UMR 680 system directly to hospitals and health systems across the country. And AHRA in Orlando was a stop on this year's tour.
Instead of asking a facility to make a 7-figure capital decision on faith, they can walk into the truck, put a patient in the scanner, and see the wide board workflow for themselves. It's a sales model built entirely around removing risk from the buyer's side.
And for smaller or more rural systems that can't justify permanent capacity, it's a preview of what flexible, shared access to advanced imaging could look like moving forward.
Last stop, and it's a big one for infection control. Ultrasound probes are semi-critical devices. They need high-level disinfection between every patient, and for years that's meant chemical soaks, chemical mists, or wipes that are only as good as the person doing the wiping.
Yeah, Germitec replaced the chemistry with UVC light. Their Chronos device delivers high-level disinfection in about 90 seconds, Fully traceable, no chemical handling, no fumes, no soak stations tying up equipment.
It's the first UVC system to earn FDA de novo authorization for this use, and it landed a national GPO agreement with Premier earlier this year. That's not early adopter buzz anymore. That's technology moving in the mainstream of how departments will handle probe disinfection.
So if you zoom out on the whole week, the pattern is pretty clear. The scanner gets the headlines, but the department runs on everything around it.
Positioning patients safely, protecting staff and tracking compliance, calming patients enough to get a clean image the first time, getting advanced equipment to places that don't have it yet, and disinfecting between every single patient without cutting corners.
Yeah, companies like KyphoLift, RadCare Services, UX Platforms, United Imaging, and Germitec are all playing a role in that from a different angle, but pointing at the same goal. And that goal is a department that runs safer, faster, and more consistently.
That's where imaging actually meets imagination. Not just in the image itself, but in everything it takes to get a patient in and out of that room safely and well.
Thanks for spending a few minutes with us for the AHRA 2026 Buzz Report. I'm Zach Matthews.
And I'm Danny Searing. We'll see you next time.